Hello, good afternoon. Trust you had a good lunch. Welcome back. And this session, we're going to focus on behavioral disorders among the youth. So we're pleased to have, as our panel, Dr. Muni Winslow, Dr. Elaine Chew, and Professor Jiao Jihe. And moderating the panel is Ms. Tan Ming Ching. Welcome, Ming. Please carry on, Ming. Thank you.
Good afternoon, everyone. Welcome to our panel on behavioral disorders in today's youth. Well, my name is Ming, and I'll be a moderator for this session. Yeah, we have an exceptional group of experts with us. Okay, so let me introduce them. Dr. Winslow is a pioneering addiction. Let me introduce a little bit more. Okay. He developed addiction services at IMH. He now practices at Promises Healthcare and the Winslow Clinic. He's a recognized expert in both substance and behavioral addictions, and he helps us understand what's happening in the brain when a behavior becomes a disorder. Okay, and Prof. Jiao Jihe is Associate Professor and Deputy Director at the Singapore Institute of Technology. He helped set up Singapore's first Cyber Wellness Center in 2006, and his research focuses on pathological gaming and how parents can better manage their children's digital lives. Dr. Elaine Chew is Senior Consultant and Head of Adolescent Services, Medicine Services at KK Women's and Children's Hospital. She's a leading expert in pediatric obesity and adolescent eating disorders, and her research has explored everything from family-based treatment to how young people use Instagram in eating disorder recovery. Thank you all for being here. We've received many thoughtful questions from you, and we've structured the entire session around them. Okay, let's get started, yeah? So, Dr. Winslow, this morning you've illuminated for us the concept of behavioral addiction, dopamine reward pathways, and the shared neurobiology between substance and behavioral addictions. In youth using maladaptive behaviors to cope with underlying vulnerabilities, how do impulsivity, compulsivity loops become self-reinforcing?
Wow, okay. I was trying to understand the question first. So basically, one of the things that you have to understand also about behavioral addictions is that there are many different types, right? There's the behavioral addiction to eating, to sex, to cyber stuff. And they apparently are not, they each have their own way of developing and reinforcing themselves. For example, we know that when we show pictures of gambling to a gambling person with gambling issues, their brain lights up, and they feel cravings and other things going on. But if you show it to somebody who is eating a bulimic or eating disorder client, then their brains don't light up in the same way. So there tend to be certain tracks, and what we realize is that a person develops dependency or compulsivity to things that have special meaning to them. So it doesn't mean that it's across the board. Like if you're addict, doesn't mean you're addict to everything. Now, having said that, there's also an important caveat which I've realized when I treat clients, is that if you stop somebody from an addiction without putting anything else in place, they tend to develop cross addictions. Like when I was treating alcoholics, I realized one day, this was 30 years ago or so, when I was a young doctor in IMH, and I was asking my alcoholic group, 20 of them, and say, so y'all have all stopped drinking for the last month or so. Do you all think that you have any other addictions? And they didn't put their hands up. Then I thought, okay, let's try. How many of you all think that you have become sex addicts after you stop drinking? And half of them put their hands up. Okay, so there usually is something else that you replace that emotional, when there's emotional discomfort or things, you're using your addiction to self-soothe or to deal with the issues or to give you that exciting dopamine binge. And if you don't get it, you'll try and find it in some other form of exciting stuff.
Yeah. Yeah, thank you. Thank you, Dr. Winslow. I think that neurobiological framework gives us a lens through which to understand all the behaviors we'll be talking about today. Yeah. Dr. Elaine, you know, eating disorders like anorexia and bulimia are not typically thought of as addictions in a way gambling, you know, sex addictions or gaming might be, yet they involve also powerful and compulsive behaviors. How do you frame eating disorders within this context of behavioral disorders in your work with KKH?
Yeah, thank you for the question. So what I was just having a conversation at lunch, and one of the first message that we have for our families, especially for those with anorexia nervosa, is the importance of nutritional rehabilitation first. We know from studies, like, in World War II, when the prisoners of war, they came out from the, the starvation state, and, people didn't understand about refeeding syndrome and they just fed them out, they can go into very catastrophic medical consequences. But what we also learn from different experiments, like a starvation experiment, is that when your brain is starved, you will not be able to engage in psychological treatment also. So it is important for us to start the refeeding process of refeeding the malnourished brain to see how much we can reverse such behaviors. Because a lot of these behaviors, like what we see in terms of a lot of obsession around food, preparing food preparation or recipes. So those can happen to anyone who has a malnourished brain. It's like when you are hungry, you get hangry, right? So that's common. So what we need to do is to refeed the malnourished brain to see how much of the psychological disturbances can be reversed. And you'll be surprised, when we do that, a lot of them may not have all these obsessions around food when we are able to nutritionally rehab them. So we start off with a lot of psychoeducation to parents, that this is the first step that we need to do. And it's something that can be quite terrifying, right? It's like, that is the thing that they are so worried about. Like what Dr. Winslow said, if they see pictures of food, actually it triggers anxiety in them. So we actually have to introduce food to them to start the process of recovery. Because in eating disorder, without physical recovery, there can be no psychological recovery. So that's what we always emphasize to parents. And that can be quite counterintuitive in a lot of mental health disorder treatment, because a lot of times it's about it's still important for us to be, show empathy and build rapport with them, but unfortunately sometimes the first step that we take can be very difficult in initiating it, because it causes so much anxiety and fear amongst families, as well as, of course, the young person involved. Yeah.
Yeah, so I'm hearing some common threads, in our discussion so far: the shared neurobiology, the emotional drivers, and maybe in some cases, maybe some loss of control because of dysregulation, or maybe the urge to seek regulation through these self-soothing methods in various ways. Prof G, your research has given us some of the most detailed understanding of gaming dependency, particularly around different player types. Could you walk us through your key findings, both on the 4 player types in adolescents, and also your adult study showing emergence as the strongest indicator? What do these different pathways tell us about who is most at risk?
Mic test, thanks. So just to give everyone a little bit background, I started in working for a social service agency since 2001, and we actually look at cyber wellness issue. And then later on, towards around 2010, 2014, I pivoted to do my PhD on how parents manage their children's video gaming habits. But in 2001, when I worked in a social service agency, at that point in time, we were looking at what they call a game designer's framework. So they use this framework on people's motivation for playing games, right? So at that point in time, there were kind of like three main motivations. But, you know, research and stuff has evolved. In some cases, some will use four categories, some will use three and all that. So in this particular research, and I think the one that you were referring to previously, we use four, although the frameworks were slightly different, but largely the same. Okay, so I'm just going to use one to illustrate what the frameworks are like. So there is the player type that's called the achiever, right? Achievers are highly competitive players. So they're only interested in leveling up. Okay, I'm not sure any of you play games. Okay, never mind. No need to ask. Well done. Okay, so these are the ones that are very interested in leveling up. So they play largely to level up. And some of the associated behaviors around this sort of player type is that he or she will look at game tips, right? Or look at certain game sequences, videos to want to level up quickly. So these are the achiever type of players. Then you have the guru. So they are motivated towards acquisition, mastery, or skill. So sometimes they may not so much interested in leveling up, but may want to repeat that level or want to try again just to master the whole thing. So for example, for the achievers, you will say, hey, I want to level up. This is the fastest way. Kill this one first, then kill this one, etc. But the guru would have a different posture towards it, want to master, may want to kill everyone, learn the techniques in killing different types of characters in the game and all that. Then you have the socializers. These are the people who purely want to socialize. You know, sometimes you wonder why you see children playing at like 2 a.m., 3 a.m. because sometimes they are connected or socializing with their friends in the US on the US server or stuff like that. I recall when I first started out playing, one of my mentors, she's an academic, she retired already. I know her motivation immediately because I played this game, I was like level 1 to 5. She's a level 80 character, okay? Then she said, I tell you what, I join you, I play. Wow, it's very good, no? So her motivation is social. So she did it because of me. It was really amazing. She came into the game, I fight so hard to kill. She hachu only, everybody die already because she's like level 80. So these are the socializers. You can roughly tell the motivation is largely to socialize. And then you have the explorers, right? These are the gamers that will like to explore stuff, you know. They will go to a town, right? They will try different kind of hats and that kind of thing. They spend most of the time there. The achievers can't be bothered. I just want to level up and stuff like that. So what we did was, knowing all these archetypes, we want to see which one are the ones that demonstrated what we term as problematic video gaming behavior. And for this particular study, we adapted it from the internet disorder framework. Okay, but in other studies that I've done, I adapted it from a perspective of occupational functioning. That means damage to occupational functioning. That means as a student, your occupation is that you must socialize, you must do well in your academics at that point in time. So anything that damages it is termed as damage to occupational functioning and therefore leads to problematic video gaming. So in this particular study, it found achievers as the one that's highest. In another study I did, which used a slightly different framework, we found it as immersion. So immersion are what we term as the explorers also. So what I want to say out of this is that what you can take home is that different people play games for different motivations. And if you want to help the person out of it, one of the ways that we found useful is to help him or her realize the motivation in an alternative, healthier activity.
Yeah. So, Prof G, your research showed that in the adolescent study, among all the 4 different player types, achievers tend to be more prone to gamer dependency, whereas your other research methodology that looked for player needs, right? The immersion actually showed more, right? Yeah, that's very fascinating. You know, it tells us that the pathway to dependency is also dependent on what needs, you know, we are all trying to look for in the game. And that's an important nuance for all of us to understand. Well, from when I look at the research that says, well, achievers are more prone to gaming dependency, on that thread, I'm thinking about how perhaps they are motivated by accomplishment, status, recognition, right? From a neurological standpoint, okay, Dr. Winslow, does that drive to achieve map onto the same reward-seeking pathways? You know, you see in gambling disorder or, or substance disorder, are we seeing the same underlying impulse manifesting? Yeah.
Short answer, yes.
Do you have a long
If you want a longer answer, then you must understand that even for the same way that there are many different types of people, like the achievers, the guru, the socializers, and the explorers. Hey, see, I was listening. In the same way for gambling, you have different types of people. Like, not everybody gets addicted to the fast-paced gambling things like baccarat or stuff like that. And so some of them, baccarat and a lot of the high-intensity things usually choose personalities who have some, again, level of achievement, but also a younger male and have a little bit of cluster B personalities in their profile. So personality also plays a role in what kind of games you go for, right? The same way that, just like your socializers and things, there are people who go and gamble, but they only gamble with, let's say, numbing out activities. For example, one-arm bandit. In the old days, there's one-arm bandit. Nowadays, it's press button one. So one-arm bandits or stuff like that. So as far as I understand, the underlying principles are the same. There's your drive to get involved in one activity or another. It depends a lot on your underlying personality, your genetics, what is driving you. Some people want that adrenaline thrill, and some people want the chill feeling that I'm just calming myself when I do this repetitively. But there are patterns, and you see that across the various things. So gaming, gambling, and all that, you also see the same pathways activated.
Thank you so much for the insight. I think it's new for me. It's the first time for me hearing that. Oh, cluster B is also one of the patterns you see. Yeah. So the next question comes from registrants, and it gets at the environment where these behaviors play out. Okay. So this is for Prof. G and for Dr. Elaine, actually. So how do online environments amplify risk for both digital addiction and eating disorder? Prof. G, we start with you from the gaming perspective.
So, I mean, when you talk about online environments, right, versus the gaming era that I'm familiar with in my time, you all look so young, so you all may not be familiar with, where you play games physically or you play games. I think the other analogy or comparison that you can make is you play games in front of a huge TV with physical people around you that you can see. Okay. Now, obviously, there are risks when it comes to, I mean, the risk is kind of analogous to what you see on the internet as well. When you socialize online, you socialize with people you actually don't know versus playing physically and stuff like that. And I think also in this sense, because of the games that you play online, there's a high chance, and there was one paper I wrote actually many years back, the fact that you now have devices very small compared to the olden times where the devices were larger, the gaming devices were larger, you can kind of play it privately. And actually for kids, they do it under their blanket or behind the bed, etc., and things like that. So in that sense, this environment, digital environment that you look at, not just digital, but because of the device size and the battery power and all this, you can actually play for a very long time, which amplifies the risk involved in some of these problematic gaming behaviors.
Yeah, I think sometimes the game design also exploit these, I mean, it's a monetization model. Exploit this kind of like, we talked about, the reward pathways, it increases the perpetuality of games, right? Dr. Elaine, how about you from your research on Instagram and eating disorders? How do online environments amplify risk on that side?
Yeah, so I think that the online environment, especially for social media and those is image-based social media, a lot of the posts are on we talk about like clean eating or exercising, and certainly this can amplify risk, especially for adolescents who are especially adolescents in their mid-adolescence period where they are looking for a lot of peer support. They are also more conscious about their appearance, so that can certainly amplify risk for body image concerns. And we also know that on social media, there's also the algorithm, right? So the algorithm will actually entice them to keep looking. If they are looking at a fitness kind of like post, it will keep on like sending more and more and more and more. And then it will be kind of like the feedback loop is as such.
True.
So, and we also hear just now from the panel too, right? Actually in adolescents, their brain are still developing. The limbic system develops first before the prefrontal cortex. So their impulse control is not there yet. So when they see such materials, they'll kind of like keep clicking on it. There's also this part about like wanting to be validated by their peers, right? If they click, if there's more likes, they'll be really happy and they'll really be more motivated by it. So then they may continue to generate such materials for it. So I think that the online environment can certainly amplify all this risk for it. We actually see it a lot, especially during COVID period. Remember the time where we were all locked down, right? Like, we had to stay at home. We saw a huge uptick in cases because a lot of the young people, they were at home and they were watching such videos and they were like, I'm getting healthy, I'm going to be doing this exercise, I'm going to try this new diet I saw on the some platforms. So we actually saw a huge rise in number during that period of time. So it can certainly amplify a lot of this risk, especially for adolescents in their growing phase. Yeah.
Thank you, Dr. Elaine. Thank you for the insight because, when I was reading your research, your research said that actually when you analyze them as a whole, you don't see most of the posts are actually pretty they do promote good values, but we miss out on the algorithmic promotion, right, of harmful content. Yeah, which is when you click one, then someone will just be fed a lot of the negative type of content, right? Thank you so much. Prof, your research highlights in-game financial spending as a key parental concern. With the rise of loot boxes and other chance-based microtransactions in video games, do you see this as a dangerous hybrid, like I said, the monetization model that is actively designed to mimic mechanics of gambling? Yeah.
Okay, so if you read academic literature done on this loot boxes, you will realize that a lot of studies actually show a convergence when they compare the use of loot boxes, the playing of usage of loot boxes with problematic gambling. So there is a convergence. There are some jurisdictions that have already banned it or considered it under gambling. Some have not yet. Some have given advisory and stuff like that. So you can see where it's heading. It's kind of like it is kind of like mimicking gambling in that sense, lah. So is it really dangerous? Yeah, because you are actually, there is a lot of monetary incentives involved. You have to put in money to play. Although in some cases you can actually use in-game currencies, but that's typically also because it is a pay-to-play kind of model where you're actually paying. So in that sense, yes, it's getting there, lah. Yeah.
Maybe they pay for something, they get more and more invested in it, right?
Yeah, definitely.
Yeah. Okay, the next question also comes from our registrants, and it's one we've heard repeatedly. How do we tell the difference between a disorder and just being a kid? What behaviors are often seen as attitude problems, but are actually signs of a gaming disorder? Are there gender or age differences you've observed in your research? Yeah, for you.
Okay, that's for me. Sorry. Okay, so let me see. Okay, like I said, there are many frameworks that you can use. One of the ones that I use most regularly is the one that looks at damage to occupational functioning, like I mentioned just now. So, for example, we ask questions like, in the past 12 months, as a result of gaming, have your results suffered in some way? Have you skipped classes in some way and things like that? So, and as a result of gaming, have you, been rude to your parents or family members and things like that? So if a respondent actually takes more than 5, we consider it like a problematic gamer. So this is one framework where we use, and a lot of academics in US also use that particular framework, at least in my discipline of studies. That was what I used in my PhD as well. So that's how you tell whether a person is problematic in his behavior, gaming behavior. If you're asking me whether there are gender age differences that I see in among, let's say, the Singaporean sample, which I largely work with, it is not so much the gender and age differences, but more the motivation. So, and again, we see that everyone's quite different.
Yeah.
So we have female players who are highly achiever type also, although very few. I do see more of them being the more socializer type, okay, which is not that surprising. But in that sense, when we look at problematic video gaming, it is not so much, it is more the archetypes. So you can game problematically whether you're socializer, but most of the time my study is showing the achiever side that's problematic.
The achievers and versus socializers, they present differently.
Yeah, correct.
Okay, thanks for that. Dr. Elaine, same question from our registrants, but for eating disorders. Which behaviors are most misread by teachers or parents when it comes to eating disorders? Maybe you can share with us what does early onset or atypical presentation can look like in your clinical experience?
Yep. So I think that commonly what I hear from parents is that initially when their child started eating healthy, they are actually very encouraged. They are happy that, previously they used to be eating unhealthy stuff. They don't feel that it's good for the child. So when the child starts to eat healthy, the parents are very happy and, may support them and say, look, think it's good. Or, maybe the child was previously very not so active and they started doing a lot of exercise. The parents may initially thought that that's a good and healthy behavior and may even encourage that. And we also have quite a good percentage of patients that were previously overweight. So when they are doing more of this health behaviors, parents are very happy and encouraged and feel that that is a good thing for their child to be doing. And I think that is, while we are not saying that all these health behaviors are not important, they are important for young people, but I think that it's important for parents to also recognize that when things take a step for the worse, like, they may eliminate food groups altogether, like, a lot of them may take out commonly carbohydrates completely from their choice or turn vegan, vegetarian, or they may spend a large portion of their time just thinking about food or preparing food or, being quite obsessed about not having any oil on their food.
Extreme dieting.
Yeah, correct. So, and that's when then parents start to realize, hey, there's probably some problem.
Yeah.
And when they realize they could see that their child just drinking in front of them, right? So then they really got worried and they start to realize that there's some problem. Yeah,
Right.
so I think that in the early kind of like signs, it is also important to, even if the child adopts some health behaviors, parents can continue to encourage them that as especially a growing adolescents, they still need a balanced diet and not to eliminate food groups. And we know that one of the key protective factors is when parents eat together with their children. So they will be able to know, are they eating well, or are they skipping their meal? So those are some of the key protective factors we always talk to our families about as an early form of prevention work. And of course, it also helps with bonding with their child, their teenagers, right? About talking about their lives, about what they are doing.
Yeah. Thank you, Dr. Elaine. So when children start to show highly disciplined eating that is not age appropriate, right? And also atypical signs, we want to look at behaviors and not just look at weight. Some people could be overweight or of a healthy weight, but they are showing signs of extreme dieting, like what Dr. Elaine has laid out. I think that's something that we should look out for also. Yeah. Dr. Winslow, across all of these are behavioral disorders, gambling, impulse control disorders, okay? Parents and professionals need to know when to act. So what early or subtle signs should adults look for across different settings? When should intervention be escalated? Anything that we've missed out so far, you can also chime in.
Hello. Yeah, sorry. Not very sure what to say because it's across the whole range of addictive or compulsive behaviors. There are so many ways in which they can present. And I think the rule of thumb is that you start to pay attention if there are negative consequences to the individual. So if they are, let's say their study grades start to go down, there's an indication that something may be going on either emotionally or in their lives. If their sleep starts to deteriorate or they don't sleep and they start falling asleep in the daytime when they're supposed to be awake, things like that. Just warning signs that, okay, what's going on here? And that's when parents or therapists should be a little bit more concerned. Apart from that, unlike the substance addictions, if you use too much of a drug or anything, there are huge consequences and we all know about it. You'll end up seeing doctor or seeing somebody or other. But with the more behavioral components like gaming and things, you sometimes don't see it until it is quite late on in the game. Plus, if it's an addiction, then the person is generally trying to hide it. As you know, with all addictions, you only as sick as your secrets, and so more that people hide things, hide the amount of time that they're spending online, hide the amount of food that they're eating or not eating, then it becomes more of an issue. But the more transparent or open that they can be, and once they start talking about stuff with either family members or good friends or therapists, then the compulsivity or the addictive behavior no longer has that much power over you.
Earlier this morning, Dr. Winslow, you talked about people who exercise excessively. And I'm also thinking about some boys who have they manifested eating disorders also in ways that they gym a lot. They have muscle dysmorphia, body dysmorphia in that way. Through weight training. What are your thoughts like? Do you have any experience with that?
No, maybe from my size, you know that I don't. But yes, I've seen some people like that, yes. It's difficult. And again, I don't think there's any one treatment modality, but a lot of it goes back to basic principles of treatment, that the more open or the more honest people can be about why they're doing something, what pleasure or otherwise they get out of it, then you are able to work through with them, okay, is this something good or is this something that needs attention? And when we don't put it on as a pressure on them by saying you must do this, and help them say, if you're doing this, then it causes this, what do you think you should do about it? Usually is a slightly better approach, because as you know, when kids or clients actually make up their own mind that there's an issue, when they have the buy-in and they decide that it's their issue, then usually things happen.
Yeah, thank you so much. All of you work extensively in this area and also actually with families. Prof G, you advocate for a parent-centric approach to manage gaming, while Dr. Elaine uses family-based treatment, which is a highly manualized protocol for eating disorders. How can a parent effectively intervene in a child's behavior without making it worse? Anyone can go. Yeah.
So how can a parent intervene in a child's behavior without making it worse. So let me give you an example. In the gaming space, right? One of the things that we try to do is to find out the child's motivation for gaming, right? So in finding out the child's motivation for gaming, then you can kind of intervene. But how do you find out the child's motivation for gaming? Or how you speak to child about gaming in the first place? So in one of my studies, this is something that a parent did interestingly. I interviewed parents and children. So I'm going to share you some of the examples that they shared. One parent actually gave up speaking to the child about gaming. But what happened was during dinner time, he spoke to his wife about gaming. And then the child was in the dinner table. And then the child was just chime in, yeah lah, crazy lah. Because there was a newspaper article that came out about this gamer who gamed like 76 hours straight and he just died. Yeah. So the father and mother were just talking that the child was like, yeah, crazy. Of course, I'll play so long, sure die one. And stuff like that. So that was some indirect way where it opened up the child. Another father who did this was, after the child's exam, he actually organized an overnight gaming session at his house. Okay, so he invited the child's, I think it was a 15-year-old boy, all his friends to come over to the house and game together. So it achieved two things. Number one, the parent actually got to know all the children's parents, right? Because, as a result of coming to a house, sometimes the parents want to know whose house is you going to, what's the parent's contact. So that's one. Second thing was the parent gained favor with the child's friends, okay? So what happened, and he accounted that to me. What happened is 2 weeks before the exam, right? He collected all the parents and said, can we collectively embargo all our kids from gaming? That means no gaming. And all the parents agreed. Okay. Now, that would have been possible if he didn't kind of like arrange that session. And then secondly, when the child went to complain to his friends, right, my dad is so unreasonable, don't allow me to play. Then the child said, hey, actually I met your dad, he's quite nice. Maybe you should listen to him and stuff like that. So that helped a lot, okay?
Wow.
So, okay, so that's how parents can kind of like find out what's going on. And then how you can intervene is what we do is that you find out the child's motivation for gaming. And actually, this applies for all other things as well. If you're able to find out a child's motivation for gaming, and then you replace it with a healthier alternative, that helps. Okay, so if it's like socialization, what we have found success is we actually get them a group of socialized gamer archetype, bring them out for a physical social setting, watch movie and all that, and then they slowly just gravitate away. I have one example of the explorer type, okay, or the immersion type. We actually brought this group of gamers to, see scenery and all that, and then we actually advised some of the parents why not you just buy a camera for your child and stuff like that. And we have success stories where the children were just, okay, I'll just take up photography because I like the exploratory environment and things like that. So these are the things that will help where you find an alternative, healthier activity to kind of like address that motivation.
Yeah. That's what Dr. Winslow said earlier, to find a replacement that fits the same dopaminergic reward pathways, right? Yeah. How about Dr. Elaine? Anything to add? Yeah.
So I think in terms of the family-based treatment, which I'll talk a little bit more later, I think it's not as interesting or fun as what Prof. G has. It's commonly a treatment that we reserve, obviously, for our patients with diagnosed eating disorder or specifically anorexia nervosa. So, but maybe I'll just talk a bit more broadly about what can families or parents do without kind of like antagonizing their kid, right? So that's when I think it's important for us as, healthcare providers or mental health providers, that the early years is actually important because they need to build that connectedness with their child. What we see, even in our practice, is that if they have already built a good, strong relationship with their child from young, then when they find certain behavior, be it gaming or maybe, some form of unhealthy dieting behavior, they are able to gently correct their child and be able to bring them back from that path, you know. So we talk about like, you know, instead of them kind of like spiraling downwards, right? So I think that you know, parent-child relationship, that connectedness is very, very important. And we see that commonly in our practice in those parents who's able to kind of like support their child, you know, in a rapid and fast recovery, or maybe not even reaching to a disorder state. In the family-based treatment that we do for our adolescents with eating disorder or anorexia nervosa specifically, it's a multidisciplinary treatment approach. So me as the adolescent physician, we work very closely with our therapy, our psychologists, our dietitian and nurses and psychiatrists in this approach, where we actually get parents to be the main caregiver and feeder to get the young person to be gaining weight for their recovery. Just now I talked about how important it is in terms of weight recovery, right? So in the initial stages of the treatment, that's when the parents need to play the role. And they need to do it in a obviously supportive, caring, empathetic manner, so that the young person will be able to view it as a form of caring for me. That's why I want to get better. Yeah. So that is the part that we support the parents very closely and journey with them very closely in this family-based treatment. Because in that treatment, we believe that families are the child's best resource to recover. So that is the tenet of that you know, the treatment itself. So we do get good, relatively reasonable, good recovery outcomes from that when we use a family-based treatment. It is currently the first line of treatment for adolescents with anorexia nervosa. But of course, it is not a simple treatment because the parents themselves have to sacrifice a lot of time to be monitoring the meals and snacks for their child. A lot of the parents do not like the treatment. It's not nowhere as fun as bringing the friends out and stuff like that. It is actually a very painful process, and some parents actually will give up doing it. Yeah. So it is a very difficult treatment process, lah. So that's why it's important to, you know, prevent the start of an eating disorder rather than, you know, when we get onto the treatment process, it's actually very, very difficult. It calls on a lot of the caregivers, and we do know that the caregivers themselves also need a lot of support in their child's recovery also.
Yeah, thank you so much, Dr. Elaine. You know, there's I'm hearing the key word, right, is showing empathy, caring, being gentle. Not like the way I do it to my niece. I tell her, "You're so skinny. No, not nice, not nice." Don't do that, right? We hear it from Dr. Winslow. He says that underlying all these is a lot of shame. They want to cover up, you know. Don't worsen it like I do, okay? But my niece doesn't have eating disorder. I'm just saying she's very skinny, yeah. But Dr. Winslow, okay, earlier you shared, you know, about the neurobiology. Okay, so if a parent is concerned about the teenager's compulsive impulse control behavior, are there early intervention strategies or mental health tips that you want to share with everyone today that's maybe similar to preventing substance abuse or something? Yeah.
Well, one of the things that is very similar to throughout all compulsive behaviors is that family gets affected by the person's behavior, one. In addiction circles, you'll say that for every one person who gets addicted, 5 family members are going to be affected in some way or other. And so one of the key things that happens here is that sometimes the compulsive behavior comes on because there is a certain level of dissonance between the parents or the family members and the individual. And so they have to find their own way of getting their highs or getting their emotional needs met. And the ways that they get it met is either in gaming or in eating or in using something or in gambling or whatever else. Yeah. So one of the key things that I've seen in terms of recovery or wellness is when families start to get engaged. It's as simple as that. The family spends more time sitting, talking. Sometimes it's because of the addiction that families get closer together because they all end up having to spend time to either work together about the issues. And one family that I had recently, amazing success after he came to see me, not because of me or anything, because this boy had autism and ADHD and was running around like crazy and refused to talk back to the father all the time. And the father was constantly, you must do this. How can you spend so much time on the internet every day? You're spending 8 hours. I said, okay, why don't parents wait outside while I talk to the boy, 15-year-old boy. I said, what would you like? He said, I would like a drink. So fortunately in my room I had a fridge. I took out a Coke, which is terrible for somebody with ADHD, okay, but gave him a Coke, and lo and behold, he looked at me, you're going to give me a Coke? And then he drank the Coke, and he became calmer. Became quieter, and he sat down, he actually listened, and I could ask him all the questions that I wanted to, and he was able to express or talk about them. And then then I said, why don't you tell me what you want to say to your parents? He said, I wish they would stop shouting at me and scolding me all the time. I'm not an idiot. I might have other issues, but I'm not stupid, which is true. Despite his ADHD and everything else, he was still scoring pretty high results in school. And so I said, okay, is that what you want me to tell them? Or you want to tell them yourself? And I said, but you know they are worried about you because you're spending so much time. Would it be possible for you to suggest how much time you want to spend? And so they did. And sometimes it's just a negotiation thing. The parents came back, and then we told them, and I told them, look, please don't shout at him, but just tell him, and then stick to, instead of shouting and getting angry and all that, stick to your rules. If he uses it more than this amount of, he cannot start going on the internet and playing games before he finishes his 45 minutes or 1 hour of homework, whatever it was. That's something they agreed on, the parents and him. And once he did that, then you can allow him to do it. And he says, what happens if he doesn't do his homework? And I said, then in that case, you switch off the internet. But nowadays, a bit more difficult because phones also got their own internet, right? But anyway, there's ways to do it. You just tell them, look, so sitting down with the parents and them and coming out to an agreement of what consequences are going to happen if you follow. And I was quite amazed. The next week they came back because they wanted to see again, and it was a remarkable change, and he's starting to listen. Of course, the first thing that he did, he came into my room and said, can I have a soft drink? So this time we gave fizzy water instead of something, a Coke, but okay. And because he felt heard, and he was willing to put in the effort to try and make the changes that the parents did. So sometimes it's just, unfortunately, parents feel that we have to, even I do make the same mistakes with my kids. We have to be able to be the arbiters and tell them what to do and follow the right rules. Sometimes we have to also listen and talk, and there's feedback, and say, okay, what can we agree on together? And then those same principles can be used throughout all forms of counseling or all forms of compulsive behaviors.
Yeah, so I'm hearing connection, co-regulation, right? Communication, thank you.
Sounds like Minister Dinesh, man.
Yeah, Coke, no lah. Yeah, so I'm also giving them a voice, hearing them voice, right?
Yes,
autonomy, but autonomy with parameters, right?
Yes.
And consistency.
Indeed.
Thank you so much.
Thanks.
Well, do we have time for? Okay, yeah. So maybe we transit to talking about technology. Okay.
I know nothing.
Yeah. Okay, so Dr. Elaine, you know your research explored using digital tools, mobile apps, Instagram to understand eating disorder recovery in a world where the digital environment can be both a trigger and a tool, and it's also very hard to avoid? Okay, how can we harness technology to help them, help young people with behavioral disorders?
Yeah, I think it's hard to take technology away, right? I mean, it's here to stay. So it's about providing them with the literacy as to how to use it wisely. I think that that will be the main message. And I think that besides providing them with the tools about how to, maybe understand what they are seeing, because a lot of times they may just passively consume a lot of all these materials and may not understand how this could be. How could this influence them, right? If they are watching a lot of all these short videos that kind of like promote certain type of behavior, they may be passively consuming and not realizing how it's impact them. So I think that it is important to think about ways that we can also teach our young people how to be more critical of all the things that they are seeing and think about it and how can it impact upon them, right? As well as their well-being.
Yeah.
So I think that there is a lot of work that we can all do collectively to be providing that form of increasing their literacy, providing that form of psychoeducation for everyone, so that we can harness all this technology to our advantage. What the good thing about all this technology and social media is that it has helped to bring down the mental health stigma, I feel, right? And then I think that a lot of young people, more than my generation, are more open to getting help, which is a good thing, right? So I think that there are certainly positive things that the digital technology has brought to us, AI and all. And I think that it is important for us to be able to harness it, to use it so that we can help our young people in their getting help in treatment and in recovery. Yeah, and of course, importantly, in the upstream prevention work. Yeah,
to build discernment. Just to confess something, in Clarity, one of our work is in helping clients with OCD. And through that process, right, sometimes when they go into remission, they need to we train them to be their own therapist at the end of the treatment. So they have to find ways, create their own exposures, basically, when the obsessions come up again. So there was one client who used ChatGPT, okay, to help her to come up with ideas on how to create exposures. And at first I was like, whoa, like, wait, what did you hear from? What ideas did you get from ChatGPT? And when I had a discussion with her, I realized that, actually she can differentiate, She can differentiate, she can detect what is good advice, what is bad advice, because she's gone through treatment already. So by the time she already knew how to discern, like neutralization, how to not play cheat with the exposure process. Yeah, so like what Dr. Elaine, you said, discernment is really important, teaching them how to troubleshoot their ability to tell right information from wrong information. Anything else from our panelists to add on this? No? Okay, if not, we have one last question from the registrants. Okay, this is something that you guys asked us to end with. Okay, it's forward-looking, and I'd like each of you to answer. If you could implement one systemic change tomorrow in schools, in policy, in healthcare, okay, what would have the greatest impact on preventing these disorders? Dr. Winslow, let's start with you.
Okay, my agent response would be enforce family meals at least twice a week, where everybody has to sit down and perhaps even share a little bit about how their week has been. And with that and with feedback, usually it's a preventive thing, because then you can pick up any problems early and you can make interventions early if needed. And youngsters will be able to at least give you their feedback of what's on their mind.
Yeah, it's important. Thank you. Prof, your one systemic change?
Test. Okay, so let me say this. Have more CCAs. So get the kids out. Okay, not the CCA that gets you in front of a computer, but get the CCAs that, makes you go outside, play sports, be active physically, or join uniform groups and stuff like that. That will help a lot.
Dr. Elaine, thank you.
Yeah, so I think just now, just similar to the message I said earlier, I think it's a lot of upstream prevention work. I think that we can do a lot more to educate our young people about, you know, the harms, as well as maybe, you know, harnessing the benefits of social media. So I think this upstream prevention work can happen in schools, in community setting, and I think it's important for all of us to support that piece of work.
Thank you all. That's a powerful set of ideas for us to begin with, yeah? We've covered an enormous amount in the past hour. Let me briefly synthesize what we've heard this afternoon. From Dr. Winslow, we know that, you know, these are brain-based, situations, disorders, not moral failings, right? So early intervention matters, and principles of connection, boundaries, and understanding function apply across all behaviors. From Prof G, we need to look beyond screen time and understand the why behind the gaming. Different player types have different vulnerabilities, and parents need support in education, not blame. Okay, Dr. Elaine, we need to stay vigilant in identifying early eating disorders early, and as onset often begins in youth, right? And warning signs can be overlooked, especially, you know, if we rely on narrow diagnostic expectations, yeah? So digital tools can be harnessed for good if we spend time with them, troubleshooting their ability to discern the right information. Okay, please join me in thanking our exceptional panelists, Dr. Winslow, Prof G, and Dr. Elaine. Thank you all for being here with us.